The chair recognizes the gentleman from Rhode Island, Mr. Kennedy, for 5 minutes.
Thank you. Thank you, Madam Chair. This legislation, the America's Health Affordability Choices Act of 2009, otherwise known as our health bill this year, which guarantees all Americans access to affordable health care without pre-existing condition discrimination. Imagine that, getting health care insurance without being told that your pre-existing condition is going to result in higher premiums, higher deductions, higher deductibles, or higher co-pays. Imagine being able to change your job at will without having to worry that you're going to lose your health insurance. Imagine having no worry that you're going to have to exceed a lifetime cap. Imagine being able to know that you're going to have catastrophic health care coverage. Imagine knowing that we're going to now move in our health care system from a sick care system that just is the most expensive that we know to actually a health care system where we actually pay for preventive care so that we actually get health care in this country, not sick care, where we pay for prevention, not sick care. We don't have to wait till an asthmatic gets an asthma attack before we get a doctor to that asthma patient. We don't have to wait till a diabetic gets an amputation before we get that critical care. We get prevention and chronic care management. And what is so great about this legislation is that it includes full parity for mental health coverage. I was proud last year to author the Mental Health and Addiction Equity Act of 2008. What it required is that we finally recognize that mental health and addiction equity is part of our health insurance system, meaning insurance companies could no longer discriminate if you had alcoholism or addiction or depression. Imagine that. We finally acknowledge that the brain is part of the body. Mental illness is a big part of our country's health care system. It accounts for over 50% of the trauma admissions in our Trauma One centers and emergency rooms every single weekend. Suicides in our country exceed homicides by 2 to 1. Suicides do. And you know what? We don't have a mental health system in this country to speak of. Because you know why? There's a stigma out there against mental illness. We still believe in this country that it's your fault if you have a brain illness. If somehow you have a lower dopamine level or serotonin level, it's your fault. We think you ought to pick yourself up by your bootstraps. It's your fault. It's a moral problem. We forget the fact that now, even to this day, we can take brain scans and tell whether someone has a differing brain or not from a normal functioning brain. But today we are enforcing what we know to be scientifically true, what the AMA said in 1955, and that alcoholism is a disease, that there is such a thing as brain disorders, substance abuse disorders, eating disorders, depression, bipolar disorder, and things of that nature. In this legislation, in this health care bill, we require parity in health care coverage. We say that we ought to recognize these disorders for what they are. And furthermore, we say we ought to have prevention. And even more in this legislation, we're going to say we're going to require medical school education to have education teaching all doctors to recognize this. That is what is important in this legislation. And I am pleased to ask my colleagues that they ought to support this legislation so that we can finally have justice for all in health care in this country. And I yield back the balance of my time.